Good day, professors, doctors, and colleagues. My name is Hanifah Syaputri. Thank you for the opportunity. Let me start to present my poster, The Impact of the COVID-19 Pandemic on Cervical Cancer Outpatients at Cipto Mangunkusumo Hospital. First of all, we know that cervical cancer places for highest in the incidence and mortality of cancer in women worldwide. From the latest global data, Indonesia is amongst the top 3 countries that contribute to new cases and deaths associated with cervical cancers. Currently, with the emergence of COVID-19 pandemic has caused disruption in delivery of health services, including cancer services. Delays in diagnosis and treatment would adversely affect the survival of cervical cancers. And so, this study was proposed to determine the impact of the COVID-19 pandemic on cervical cancer outpatients at Cipto Mangunkusumo Hospital. Now, turning to the method. This cross-sectional study includes cervical cancer patients at Cipto Mangunkusumo Hospital from January 2019 to December 2020. And the data used in this study were retrospective secondary data obtained through INASGO Hospital-Based Cancer Registration (HBCR) at Cipto Mangunkusumo Hospital. This study involved 322 cervical cancer patients as result subject, in which result indicated a decrease in number of new patients reports from 2019 to 2020 by 70 cases. After WHO officially declared coronavirus as a global pandemic on March 2020, the prestige of COVID-19 among Indonesian people began to spread and caused concern from some people over going to the hospital. At the end of March 2020, large-scale social restriction was issued to accelerate the eradication of COVID-19. In Jakarta, the first period of social restriction was begun in April 2020, and Jakarta government has retightened the social restriction by second period from the end of April to May 2020. That makes the average incidence of cervical cancers decrease during this period of social restriction. At the beginning of new normal on June 2020, the central government and several local governments began to loosen restrictions and restart several sectors with the implementation of health protocols. It has increased access to health services also because of an urgent disease worse complaint, causing many patients to return to hospital after social restriction. Now moving to the staging distribution of cervical cancer. The advanced stage cases during 2020 has increased compared to 2019. These results also according to a previously reported study that after the implementation of lockdown, most of patients represent with stage 3 and 4. Based on that, delays in seeking care, attending appointment with first oncologist, and initiating cancer treatment had a negative impact on treatment outcome of cancer patients, including those patients with end-stage presentation at first diagnosis and progression of cancer to advanced stage. As a conclusion, decrease in new cases of cervical cancer during COVID-19 pandemic in this study are proven similar to previous study. The delay in diagnosis is likely to lead to a later stage presentation, and studies regarding decision and further observation in cervical cancer treatment delays due to COVID-19 pandemic are still needed to be discussed and explored further. Thank you for your attention.